Now, today in this video presentation, we are going to talk about familial hypocalciuric hypercalcemia. Now, the calcium exists in our body in different form. 40% of the calcium is protein bound. Which type of protein it is bound? It combined with the albumin and the globulin, and this is the 41% which is non-diffusible. Non-diffusible means this protein bound calcium cannot come out of the capillary to produce the physiological effect. 9% of the calcium may complex with the different type of anion like phosphate. Okay, now this is diffusible. Now since this is not free form or ionized form, again this is not going to produce the physiological effect. But this 50% of the calcium, it is in the free form or it is in the ionized form. Now this 50% which is 1.2 millimole per liter is diffusible, that is going to produce the physiological effect. So the total amount of calcium, if you see over here, it is approximately 10 mg per deciliter. So 40% is protein bound, 10% make complexes like phosphate, and 50% of the calcium is ionized form or in the free form, that is going to produce the physiological effect. Now, if you see, the plasma and the interstitial fluid have a normal ion concentration of about 1.2 millimole per liter. Over here, you will be able to see, or it is 2.4 milliequivalent because it is a divalent ion. A level, it is only half of the total plasma concentration. Now this is 2.2 and this is 1.1. So this is half and this is double. So the calcium amount in the serum is 2.2 and of the serum level it is only 1.1. So this iron calcium is the form that is important for most function of the calcium in the body, including the effect of calcium on the heart, nervous system, and bone formation, and so on. Now, A is represented the maximum amount of the parathyroid hormone secretion. D is denoting the minimum amount of the parathyroid secretion. This is the minimum amount, not zero. Okay, so when there is a high amount of calcium is there, the amount of parathyroid does not become zero. It is minimum but not zero. Now C is represented by the amount of the calcium at the midpoint, which is also known as the set point. And the curve of this graph is denoted by the B, slope of the curve at the midpoint. Now the curve can be represented by this equation. Okay, so from the curve itself we can see that as the amount of calcium decreases, the amount of parathyroid hormone is going to increase. Okay, now the sigmoid shape of the curve, this is the sigmoid shape of the curve, reveals some of the important physiological properties of the parathyroid gland. Number one, what does it say? That it is the minimum amount it can produce in response to low amount of calcium, but it has got a reserve. Okay, that has the amount of calcium decreases, the amount of the parathyroid hormone can increase. So this is the maximum amount. So number one property, it has got minimum amount of hormone can be secreted but not zero, and maximum amount of hormone it can secrete. So this sigmoid shape curve has been designed in a such a way that it can produce the maximum effect during the hypocalcemia and not in hypercalcemia, and designed in such a way that it is going to produce the maximum amount effect during the low amount of calcium and not in the high amount of calcium. Now we are going to understand this FHH with the response of the parathyroid gland to the change in the plasma level. Now the secretion of the parathyroid hormone. Over here you will be able to see this is the maximum secretion and this is the minimum secretion. Now this curve is shifted toward the right. Okay, now at a very high level of calcium there will be inhibition of this gland to secrete the parathyroid hormone. Over here you can see, over here at the position of 9 there is a minimum amount of the secretion from the gland, but over here you will be able to see over here the blue portion at about 12 mg per deciliter there will be a inhibition of the gland, but parathyroid hormone secretion is absolutely normal. So the set point has been shifted to a very high level of calcium. Now what is the problem in this type of patient? There is a mutation in the calcium sensing receptor. So the calcium sensing receptor in working at very low level, in activation mutation is there. Okay, so there's a loss of function of the receptor is there, not gain of function. Now if there is a gain of function of this receptor is there, okay, these condition can be seen in cases of familial hypoparathyroidism, in which you will see not hypocalciuria, but in these patients are going to see hypercalciuria patient. Okay, if there is a uh, gain of the function of the this receptor is there. Now how much of the calcium is being reabsorbed? What is the plasma amount of calcium is there? As compared to the normal person, the amount can be increased to as much as 10 to 30% more. Okay, so normally the normal person is having 2.2 to 2.7 millimole, but this can be increased in this type of patient to a level of 3.0 to 3.3 millimole. Okay, now the amount of calcium in the blood is high, but these type of patient can tolerate the high amount of blood plasma calcium level. Okay, but these patients are predisposed to kidney stone, fatigue, or loss of mental concentration. Okay, so in this condition, the amount of parathyroid hormone which is being secreted is normal amount. Now, in the DCT in the kidney, there is a mutation in the calcium sensing receptor is there. When there is a mutation is there, it is not working to its optimum level. Okay, now this calcium sensitive receptor is not going to be inhibited unless and until the calcium level increases too much. You have seen that the curve is shifted to the right as far as the parathyroid hormone secretion is there. So at a very high level, parathyroid hormone secretion is going to be inhibited. So in these cases, very high amount of calcium is going to inhibit this calcium sensitive sensing receptor in the DCT portion of the kidney. So there is two characteristic features, that if large amount of calcium is being reabsorbed, we will always going to find low amount of calcium in the urine and high amount of calcium in the blood. So the discovery of the calcium sensitive receptor had led to the finding of the calcium sensitive agonist, with which are calciumatic drugs. These drugs mimic the action of the calcium ion. Now in cases of parathyroid cancer or hyperparathyroidism secondary to the renal failure, in these conditions what is happening, there is a high amount of calcium in the blood, in the plasma. So the objective is to decrease the amount of calcium in the body to a normal level. So this drug bind to this receptor irrespective amount of the calcium which is present in the plasma. Okay, even in the low level of the extracellular calcium it is going to bind, or at the high level also it is going to bind. When the drug bound to this receptor, okay, now there is a suppression of the parathyroid gland to decrease the secretion of the parathyroid hormone. Now with this hormone goes to the small intestine, to the kidney and the bone, and from all these places there is a decreased reabsorption of the calcium happen. As a result of that, hypercalcemia become at a very normal optimum level. Thank you.